Hello, everyone, and welcome to another episode of the Med City Pivot podcast. Today, I'm your host, Katie Adams, Associate Editor here at Med City News, and I'm excited for this episode, which is brought to you by PointClickCare. PointClickCare is a health IT vendor focused on the long-term care and post-acute care space. And during our show today, I'm going to be talking to one of the company's leaders, as well as a physician from Sutter Health, to learn about what that technology looks like in practice, specifically how they were able to improve patient outcomes in the emergency department with that technology. But before we dive into that conversation, here is a quick message from PointClickCare.
Our healthcare system is on the brink. Overburdened, disconnected, built on outdated foundations that can no longer support the strain. Patients wait. Providers burn out. Gaps widen. But healthcare was never built to operate as a system. At PointClickCare, we're designing a smarter future for healthcare. We unite care, billing, and operations so information flows, transitions happen effortlessly, and you can focus on what matters most: your patients. We're building a world where every piece fits together. Clarity cuts through chaos. Data drives decisions. Workflows actually work. And care creates change. At the heart of it all, our mission is clear: to help every provider deliver exceptional care. Together, we can ensure that generations to come will benefit from healthcare that is built not just to survive, but to thrive. It starts now. It starts with you. It starts with PointClickCare.
Okay, let's get into it. Please welcome to the show Dr. Hamid Husseini and Dr. Barbara Bond from Sutter Health. Thank you both for being here.
Thanks for having
My
us.
pleasure. Thanks for having us on.
Yeah, of course. So first I want to talk about the emergency department and what a chaotic place that can be. I know that every minute counts there, and these care teams are often making decisions without all the data they need, without that complete picture of the patient's care journey. So I'm wondering what challenges might present themselves when that patient history isn't available and how that might impact the quality of care.
Yeah, I mean, I think you've hit it on the head, really, that can be a chaotic place, and there are many diagnoses for which time is of extreme essence. And when a patient arrives and we have limited information, it can really impact their care or delay critical intervention. So, for example, if we don't know the patient's most recent correct code status, we may be providing a medical intervention that they either didn't want or did want and didn't receive. If we don't know whether they are on blood thinning medications in the event of a stroke, they may receive thrombolytic medications that were inappropriate. So being able to get that information in real time right at your fingertips is critical.
Yeah, I mean, I think I'll build on that and actually maybe take it a bit more, of a simpler view of sorts, right? Like, I mean, as an ER physician myself, one of the things that we often sometimes I think forget about because we get so tied up into the excitement and the busyness and the interactions that exist in the emergency department is really when we order tests because we don't know what we don't know, right? And so the fact of getting this kind of insights and these kind of data ahead of time is really providing us information to answer the questions that we may have. And so then we can start checking off potential needs for certain tests, potential interventions, medications, or even potentially an admission versus discharge. And so I think it's really just getting to the essence of being able to get information and answer questions that otherwise we were going to have to order tests for.
Yeah, it seems like in that environment, speed is really key and time is really of the essence. And when we're talking about all this data, I wonder if we can talk more about how it really affects the decision-making process, the clinical decision-making process. Can you talk more about how clinicians use that real-time data to then make quicker decisions and improve the care transition process for their patients?
Sure, I'll jump in first this time. I think at the end of the day, what we need to do is make the right decisions at the right time and make sure that we're not making a mistake. Being able to use this data at its fingertips right when patients arrive is the key. 2 hours after you've ordered your entire workup is too late. So the key here is being able to take this information on the front end, use it in your workup, ultimately let it influence your disposition, and ultimately change outcomes. And so it's sort of a if then what type response, but it's so important having this at the beginning of that interaction with the patient.
Yeah, and I would add that, I mean, I think everywhere in healthcare, but especially in the ED where it's time sensitive, the providers, the physicians are awash in data. The problem isn't there isn't enough data. The problem is that the data is not curated or collated in a way that it's easily accessible. So I could go in and spend an hour or 2 hours finding a complete information on a patient by digging through the EHR, but no one in the emergency department has time for that. And so what ends up happening is usually people don't even take the time to look and they miss essential information. So as Dr. Husseini is saying that, you know, if a patient has had 5 head CTs for the same condition, but I don't know, they're going to get a 6th, right? Which could be detrimental to the patient. But if I have that information right at my fingertips, like he's saying, where it's almost passively coming to me, I don't have to do much, but just look at it. It is an incredible time saver and actually reduces utilization of healthcare and unnecessary exposure to risk for patients.
There also seems to be a lot of moving parts, obviously, but a lot of collaboration involved, which doesn't always go so smoothly in healthcare. So I'm wondering if there are any strategies that you guys have used that can help these hospital and post-acute teams get on the same page. And when they're on the same page, I'm sure that there's smoother handoffs. So, Dr. Husseini, maybe you can start us off again.
Yeah, I mean, the way I like to think of it really is around sort of a proactive and a reactive approach. It seems like in healthcare, we talk about preventative healthcare and we talk about sort of episodic care or acute healthcare. But in this case, it's how do we potentially prevent the need for a transfer from a hospital to or from a skilled nursing facility or even out in the community to the hospital. But then also when that happens, how do we react accordingly, have the information that Dr. Bond mentioned where it's not this much information, it's just the right amount. It's easily digestible. It's going to answer somewhere between 50 and 70% of my questions, because if we create something that's answering all your questions, then it's probably too lengthy and too in depth to really be usable in the emergency department. So I think the real sort of magic here, if you will, is making sure we create reporting that's standardized and is approachable and can be sort of used bilaterally. So to the hospital and then away from the hospital back to the skilled nursing facility when they receive patients and transfer after discharge from the hospital.
Yeah, and I think I would add to that, the emergency department is really the nexus of care in many ways, that patients are constantly traveling through different phases of care, um, to the ED, inpatient, discharge to home health, to skilled nursing, in and out. They're moving seamlessly through all these different phases of care, but the information about these patients is not. So it's very, very siloed, and how this can help and also I would just add to that transitions of care are very high risk time for patients and for healthcare organizations, right? So having tools that really help us get that information at the time of transition is really vital. And that is what creates a sort of communication around the whole patient care journey that is really lacking right now in healthcare, from what I've seen.
I hear so often from hospitals too that they really don't want to keep patients in the emergency department or in the hospital longer than they need to be. It's obviously important on a cost and revenue side of things for providers, but also for patients, for a comfort and cost perspective as well. So, how is this data, these integrated insights, how are they continuing to improve that throughput and reduce that length of stay?
I can start with that one if you want. Our acute care facilities, for the most part, are in a crisis of capacity. So aside from everything else, we are often just do not have enough space for all the patients who need our care, either in the emergency department or just on the admission side and the acute care side. So anything that's going to help us with capacity is an incredibly important tool. So aside from revenue, aside from, patients' care and comfort, this is a problem that is going to continue now into the future. So we've been able to use what we call dedicated care insights, which are like a roadmap to care for patients who have very complex health, medical needs, or psychosocial needs. So it provides a roadmap to care there's been due diligence done before the patient ever arrives on what's the best approach to care for this particular patient. What's the safest disposition plan for this patient? So the second they arrive in the emergency department, everyone who's involved in the care of that patient can follow that roadmap if it's clinically appropriate. And so I think, that is what this tool is providing us, and something that we've seen real impact with emergency department utilization, emergency department length of stay, and actually inpatient utilization and inpatient length of stay. It's been incredibly useful in that sense for the patients for whom we've written these insights.
Yeah, and I will say that Sutter has been an incredible user and partner of an adopter of using these insights. I mean, they've really done an incredible job. And I think one thing to highlight about that is that, I think there was a dad joke a long time ago or something that said, if a tree falls in the woods, does it make any noise? But if nobody hears it, and that's the whole point that I think that these insights also gather, is that when Dr. Bond and her team at Sutter write an insight and that patient ends up at another facility, they may never hear of the long-term impact that actually has for that patient. But if that patient has an opiate use disorder or has a chronic health condition that ends up in the hospital, and what we do know about hospitalization is it increases morbidity and mortality because of all of the complications that can occur from hospitalization, especially when unnecessary. So when we start thinking about the implications of not just using the insight, but writing the insight for others to use, it has lasting impact, and often more impact than we'll ever realize.
Well, it certainly seems like you two have had some success working together. So I'm wondering if we can give some advice or share lessons with other health systems. Maybe Dr. Bond, will start with you since you work at a health system. What lessons would you give to other hospitals so they can strengthen their own transitions of care?
Well, I think, following this model and investing a little bit in the resources to engage clinicians in this work, I think that would be my first recommendation, is that the clinicians are able to provide information and create information for other clinicians to really be able to act on it in a meaningful way. So that would be one thing, is use your resources and the clinicians you have available to help with these tools. And then I do think that there is a huge amount of sort of untapped resource with these tools in terms of really looking at readmissions for patients with heart failure or COPD in terms of the CMS guidelines, all cause readmissions. And we're, looking at tools for immediate notification when a patient arrives in our emergency department who's a safety security risk, a patient who is followed by palliative care. We even have a project where a patient who has LVAD, left ventricular assist devices, if they show up in any emergency department that is on this system, and that's a lot, that team is notified immediately when the patient arrives in the ED. And being able to intervene early and act early and make decisions about the disposition of the patient as soon as they arrive it's a whole different opportunity than waiting until the patient is 5-6 hours into their stay and then trying to, shift direction. So I guess that would be my advice, is really use your team and use the tool, and there's sort of no end to the opportunities with it to improve your capacity and patient length of stay and patient quality care.
And I think to sort of come alongside that, I think organizations need to sort of have the will and get equipped, right? I mean, you can have an organization that has all the desires in the world to do the job of and the hard work of care management, case management, and making sure that they're providing the right care at the right time. But if they don't have the tool to do that, it makes it really hard. It makes it almost like a guessing game in a lot of ways. And vice versa, if you have the technology, but you don't have the team that's willing. And so I think at the end of the day, it's creating a culture of the desire to make the world a better place inside your emergency department, one patient at a time. Leverage technology to be able to work smarter, not harder, and ultimately look when you get the results that you desire, share them with others and be a light.
So you gotta share your insights with others. You have to use your team, your resources. There's a lot of different nuggets of wisdom there for health systems to take with them. So thank you for that advice, and thank you both so much for being here today.
Thanks for having us.
Absolutely, thank you.